why don't you stay there? And now we'll open up the for 10 minutes questions regarding these two wonderful presentations. Questions? Yes.
So the role of the facilitator seems really important in many of these kind of studies, and I really, really enjoyed this presentation. Thank you very much. Can you just tell me a little bit more about were the facilitators from the actual units, or were they people from the outside? Can you describe a little bit about that?
Right. So first of all, to address a previous issue, we have so many people in our current workforce into which their roles, quality improvement doesn't exist. And so, you know, we hit the units, we have 12-hour shifts, we have medications to deliver, we have to sign up for an incident report if we're 30 minutes behind. So all of a sudden comes, you know, and now let's stop and reflect. So a lot of it was about reflection and retooling the current workforce to embed this in their functioning is a huge problem and a huge opportunity, because we can go upstream and educate folks, and I think that our curricula are changing that way. However, we have this real opportunity and a clear and present danger in today's workforce where none of us were really taught with these tools. So the short answer is Amanda is a nutritionist and had worked in a nutrition clinic providing services, knew not very much about inpatient hospital nursing or nursing staffs. So we sent her to the training center that Dr. Ferrer referred to, where practice facilitation, she went through a 3-day training and had continued support from that center. The facilitation that went on has been used extremely successfully in primary care. So one of the innovative parts of this project was to move it into acute care. So the short answer is no, she was not on the nursing staff, and it made creating the academic practice partnership so very important, and we did invest a lot of energies in not showing up with a project and an external person and then moving away at the end of the no-cost extension. So, I mean, we found funding, and our commitment to our partners is such that, you know, we want to see if we can actually move the model in and have someone trained internally in practice facilitation. It's a 12-step, a 12-month kind of intervention.
Yes.
Hi, thanks. 2 questions. Could you just briefly explain how you think this approach is different from sort of the history of total quality improvement and what you think is new and different about it? And secondly, what do you think about the financial sustainability of this once you all leave?
The sustainability, I'll start with that question, has always been on our radar once we demonstrated whether or not this was effective. That the quality improvement, we don't have a cost component in that analysis, which is, as we know, difficult to do. However, we would call on our partners to examine the kinds of activities that were occurring, and we are tracking for them nurse satisfaction, employee engagement, those things, the NDNQI outcomes that we think have cost impact. So the sustainability, we really have a dream of seeing it become an internalized kind of activity. To the first question, in moving and finding the time, even the communication channel was a surprise not only to us as the academic partners, but also to the practice partners. I mean, the first go at it, the CNO says, well, we'll just announce and we'll call a meeting and you can get all your baseline data. And so we learned with them, Mary, about that it doesn't work that way. So we had to be very creative in terms of engaging them where they were at the point. And Amanda was extremely present on the unit. So I think that the CQI elevated to the point of being part of what we do as our accountability in patient care. We have to continue to make that transition in the way we think about quality improvement.
Did we answer the second question?
Can I just add?
Yeah, of course.
I think, you know, the CQI is really, it's the last step of what we're talking about. But what we're talking about, I think that is going to be the more important thing is everything that comes before that. So capturing a theme from the panel is organizing the workforce and how people think about their work in a new way, so that the frontline experience is valued, and all that intelligence that they're able to gather about the issues in that hospital that get in the way of changing the culture, they're not, they don't lie dormant and unexamined, because that's a lot of lost valuable information. So this is a way to bubble it up from the front line all the way up to the executive suite and the middle management, and to change the way that the enterprise thinks about identifying opportunities for change. The other thing in terms of sustainability at Hospital B, which is actually quite a bit more sophisticated, we're experimenting with them actually hiring one of their own internal people and using their nurse managers who have more experience in supervising this kind of work for them to actually act on the intelligence. So we're going to their hospital, we're doing the pocket card study, we're going to give them that information and then see what they do with it. With the idea that if they're sophisticated enough to then do steps 4 through 7, having us help them initially with some of the data gathering, that may be a sustainable model if organizations can use some of their own internal people to do that.
This is just an observation that a lot of this is really you're trying to process a unit that isn't as well-functioning as a really well-functioning unit might be. And if you think of a real well-managed, well-functioning unit where nursing is respected, that input already would have been filtering back, and the nurses would have been developing those solutions themselves from the start. I know of units that have worked like this for a long time. They're relatively rare, and I think the really issue is that once you can develop that culture, it can be internalized, and you don't have to have the additional resources. But it takes time to get there. And as a sort of future directions of, okay, how do you get units to build this into their own culture on a permanent basis where you don't need the facilitator, that the nurses are encouraged to identify the problems and work together as a team with the nurses and the other parts of the care team, which vary across units, to develop these solutions to the problems on an ongoing basis as just part of their regular functioning.
Yeah, probably an overused term, but very important, and that is an empowering process. And I think that's one of the unique things about this project, too. It's very empowering.
Sorry. How much of this is facilitator dependent, or do you have any speculation on that? Could you put it in a box and mail it to Idaho?
Well, I'll bring in some other data. So I was just part of the evaluation team for the national demonstration project on patient-centered medical home, 30 primary care practices. And there was a fair bit of variability among the facilitators. They had 30 practices, and so one facilitator wasn't going to cut it. And so I think the facilitator role is important, and there probably is we have to pay attention to how we're training the facilitators to make sure that they're working effectively with the practices. So we don't have a control, we don't have any variability in our facilitator, which is why you asked the questions. But I think that's important.
So if I could add to that, some of the embedded things that we did were beyond the facilitator. We enacted unit-level champions that were connected to unit-based practice council types of ideas that are promoted through Magnet. And we also embedded what we decided were not initially frontline, but turned out to be very frontline of those mid-level managers. So we had the unit directors engaged in this. And while the facilitator identified PDSA, spaghetti diagrams, many of the quality tools to use in thinking and reflecting, those things were new to the unit. However, the pickup on this and the desire to move down the road of excellence, we think we did a really good job of engaging and embedding beyond just a single facilitator. We were very committed not to leave a vacuum when the project was done.